when you're in CCS, you are it. So I was thrown in the deep end with dogs with fractured legs and things, and I had to do these front limb amputations, and I had a mandibular fracture repair that I had to do, and you just try and survive. And I think that's why the overseas practices are desperate for us, because we can just cope. We have the resilience.
So a very warm welcome back to the Paws and Effect podcast. I'm your host, Dr. Cara, and I'm in the studio today with Dr. Caitlyn Rossenrode. Welcome.
Thank you for having me.
So you are a vet who's based just down the road, and
Yes.
obviously it's the first opportunity I've had to meet you.
Yes.
So welcome, and thank you very much for your time
having
today.
me.
So you've been in practice for a year.
Yes,
February
practice, yeah.
Private practice. So you qualified at Honest Support, is that correct?
Yes, yeah.
Where were you from? Were you always KZN based? Or?
So my parents, and I grew up in Winston Park, went to Hillcrest High School, and always wanted to be a vet, and got in after trying many times, and then
It's quite a road to get in.
Yes,
especially in this country, isn't it?
Yeah.
So you struggled and struggled. What did you do anything first, or did you take another path, or did you just wait for your place?
So I initially applied to vet in my grade 11 year, didn't get accepted. Applied in matric year, didn't get accepted. Then I applied to do BSc Animal Science. So I did a year of that, and then that year I got finally accepted into veterinary science. So I did a year of animal science and half of my second year before I did eventually get into my second year at veterinary at Onderstpoort. The degree itself is 6 years, so I did 7.
Just one extra year.
Yeah, which I was lucky, because some people do keep trying, and they have to do full degrees before they get in. It's quite difficult because they only accept about 250 or odd people a year, and Onderstpoort is the only university that you can go to study vet.
So there's a lot of pressure, I can imagine. I obviously qualified in the UK, where there are a few more than that, but there's a lot of pressure getting into the degree, and then it's a high pressure degree. There's a huge volume of information, and you've got to disseminate it, and it's not always technically difficult, but it's a lot, and it just keeps coming, and it's compounding, isn't it?
Yeah.
So from going and qualifying, it must have felt amazing. I mean, you fulfilled your dream. I mean, you really wanted to do it. You then have to step out, and this is a new thing for me, because it came into in place I think probably 2 or 3 years after I came back to South Africa, that post-qualification you're expected to do a year of community service. So the medics have been doing this for a long time. How was this received? Was this something that you expected to do when you went into the degree? It was already established as...
Yeah. So I think I only went into my second year in 2017. The CCS program, I think, started in 2016, if I'm not mistaken. So they told us when I went into my second year at Onderstpoort, you're going to be going into community service after all of this. If you want to stay in South Africa, you have to do a year of community service with the government. Even outside vets, if they want to come and work in South Africa, they have to do a year of community service before they can be registered with the South African Veterinary Council.
And this is not just, I'm happy to be placed in KZN, I'm going to come back, I've just qualified. You don't have a lot of choice. You can indicate where you'd like to be, but most of these positions are in the middle of nowhere. Is that correct?
Yeah, so there are some really nice positions that are in the cities and everything, but obviously everyone wants to go there. So they give you 15 choices. In total, you rank your number 1 to number 15, and you have to have at least, I think it's 5 provinces represented. So you can't say you want all 15 in Gauteng or all 15 in the Western Cape. So you have to have a representation of each province that you want to go to, and then they randomly select on a computer based on your choices where you go. And then some people, shame, unfortunately get second rounded. Some of them don't even get any of their 15 choices. So you have to be quite strategic as well in how you choose, because if you're going to be choosing the very popular places, the likelihood of you getting those places is less. So I was lucky and I got one of the positions that I put in my 15. It was actually my 12th choice. But it actually should have been way higher because I loved my community service here. And not many people can say that, so I am lucky.
Yeah, I was going to say, there's not... most people don't give that sort of feedback, so that's great. So tell me what was good about it. What did you take out of it?
I was placed with there were 3 of us posted in total. So that in itself was a blessing. The fact that you had other people to talk to, because as a new vet out of OP, you don't have your higher clinicians to talk to anymore. You are it. So having friends and colleagues to talk to about cases really helped. That was number 1. And number 2, my supervisor was lovely. She helped support us whenever we needed, and she was always there, which also not a lot of people can say that. And number 3, it was a good experience in the sense that you don't have a choice. Like in private practice now, if you're not comfortable with doing something, you refer to a specialist or whatever. When you're in CCS, you are it. So I was thrown in the deep end with dogs with fractured legs and things, and I had to do these front limb amputations, and I had a mandibular fracture repair that I had to do, and you just try and survive. But that's also shows the standard that South African vets are coming out of, is that we just have to deal with it. And I think that's why the overseas practices are desperate for us, because we can just cope. We have the resilience.
Resilience is something. and a good work ethic. I mean, that's something. I mean, I know living in the UK, they were like, "Oh, you're South African." I was like, "She did my high school here," but I have the upbringing of South Africans, and we are recognized as hard workers and enthusiastic, and so that definitely stands in your favor. But let's talk about that, because a lot of people really struggle with that year. What are the things that you find impact CCS, your CCS year the most? Is it where you're based? Is it the support? What do you think?
Where I was based was in Queenstown, so it was a lovely area to be posted in. So I can't talk really about any of the other posts. Our main struggles were the medical supplies. So we battled a lot with stock and actually having things to do our job. That's when you have to start being creative and having a good partnership with your private practice vets and community help as well, to try to get the supplies to be able to do your job. But yeah, so the one time we got a whole tray of vaccines, and that was supposed to last us a whole year. Like, it lasted us a month. So that's the sort of issues that you're dealing with in CCS, and that's when you start to need to be a little bit more resourceful in how you're going to cope, because in those areas, primary animal health care is the most important thing. You're not seeing these old animals that we're seeing. It's mainly your parvo, your distemper, all the things that we don't really see in private practice anymore, the biliary, the everything. And that was one of the, when I said in my interview, Nick was like, "What have you been doing in CCS?" And that's what I said to him, like, mainly that stuff. He's like, "Oh, we never see that anymore here." And that's just shows you how desperate they are in those areas. Those diseases are still prevalent and still around. And rabies, unfortunately, is still rife in KZN and Eastern Cape and, everywhere.
Hi there, pet parents. This is Dr. Cara, the Ultra Pet Vet. I'm excited to introduce Ultra Pet's premium recipe for miniature and small breeds. Ultra Pet's smaller kibble size combined with calcium and phosphorus helps keep their teeth in tip-top shape. We've added omega-3 to support their heart function while keeping your little one strong and healthy. Ultra Pet has included chondroitin, glucosamine, and green lip mussel extract to help your dog's joints, and L-carnitine to manage weight. Prebiotics play a crucial role in maintaining a healthy digestive system by nourishing the good bacteria in your dog's gut. The best part? UltraPet offers a 100% money-back guarantee. Visit your local vet or pet store to make the switch now. So I'm going to ask you a bit of a controversial question. Also, as an employer, one of the concerns that we may have, don't worry, we've got over it, is that often coming from a CCS year, especially if you haven't had a lot of exposure to clinical cases, because there are some posts, and you can possibly elaborate a little bit, where it's health inspection, or it's totally out of where you see yourself longer term. You may be posted to a position where you're based in a lab. And so you spend a year not keeping up with your clinical skills. And so when you start in private practice, it feels like you might be at a bit of a disadvantage versus coming out of it. I've just done my exams. Now I'm going to go and apply all that practically. Do you find your colleagues have struggled like that, or is that just a misconception?
Those in those lab type jobs, they have struggled, especially with surgery. Like at Onderstpoort, you only do one spay and one castration, and then the rest, surgically wise, is up to you. So a lot of that hands-on stuff which is why I wanted a clinical post for CCS, is you need practice. And CCS is the best way to get that practice, because you can make mistakes, unfortunately. And it is a learning year. So most of my friends that have done these lab posts, they locum as much as they can, but obviously there are restrictions with them having a full-time job and then still having to locum afterwards. And there's a bit of a grey area with how government wants you to be registered as a locum. There was, at one point, it was okay, and then they said that it wasn't okay. So it is definitely, I feel sorry for people that are in those posts.
Because that does mean sort of starting on the back foot with regards to.
Yeah.
So that transition from CCS here, which has a role, obviously has a great role in terms of contributing for animals that otherwise wouldn't have any or the adequate care, despite the limitations with stock and supplies, and stepping into private practice. Now, I know that you've joined a practice that's very supportive. You're part of Watercrest Vets, and Dr. Nick Sturck loves teaching and loves sharing information. And clearly, you've enjoyed it because you've been with him at least a year.
Yeah.
How did you find that transition?
It was difficult in the beginning because, as I say, like a lot of the work before was primary animal healthcare stuff, and you didn't see old animals. Like it just wasn't a thing. And now you transitioning into private practice, and you are seeing the older patients that now have the kidney failure, the cancer, the liver failure, all the other. It's more medically orientated, I would say, as compared to what you see in CCS. CCS is like you trying to just survive, and you get the fractures and the bite wounds and blah, 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 blah. And then private practice is just, it's different. But yeah, it's still very enjoyable.
And how important is it to choose the right practice? Would you advise, based on your experience, the vets who are perhaps qualifying now and going into their CCS, what would you advise them in terms of finding your first job?
Definitely needing a good mentor is important. So you can feel very lost going into private practice initially. So having a good mentor is the utmost importance, and having that support. Once you've got through your first 2-3 months, I would say, then like you can be on your own a little bit, but you still have someone to lean on. And then I feel like that's going to be the same throughout the whole job. I know Nick still asks vets what their opinions are on certain cases and stuff. So it's never, you don't ever be afraid to ask questions, because we are always human. We don't know everything. We're always learning.
So true.
Yeah.
So what were the tough things when you first started? What did you struggle with the most?
It was mainly the clients. that I struggled with the most, trying to manage their emotions with the patient in terms of their finances. A lot of the time, you have a certain treatment plan that you would like to do, but not everyone is on pet insurance, so they can't afford it. So then you try and manage them, the patient, and the whole situation as best as you can. I think that was my biggest challenge in the beginning, and I wish everyone was on pet insurance and I could just do my job without worrying. But the realities are that money does come into it.
And it can be quite limiting in terms of the cases. So how did you find that clients treated you? I mean, you obviously they had a good introduction to you on social media, like welcome to the team. How did you find? Did they ask to see Dr. Nick? Was there an element of people accepting you? It's in some respects it's probably quite nice having a male and a female in the practice because clients may have a better rapport with one gender or the other. But how were you generally received? And I'm asking this because I'll tell you my experience of when I first arrived. I was alluding to it this morning, where people were going, well, we want to see the vet. Are you not the receptionist? And so they were quite worried about seeing. I mean, obviously, I still look as young as I did before. I don't have those problems anymore. But they did not want to see someone who they perceived as inexperienced. Have you faced any of that?
On the whole, generally, everyone at our practice is lovely. Most of our clients have been very accepting of me. I could probably name names on my hand where I've had issues. And the clients that are diehard Nick fans, they do say, I prefer to see Dr. Nick, but I don't take that to heart. There's only been some occasions where they've been like, how old is that vet? Or as soon as I start seeing they not happy with what I'm saying, I tell them I'm going to discuss it with Dr. Nick, and then you can just see that they relax. So I think a lot of the time, as I say, is managing the clients and reading their behavior is probably the hardest part.
And definitely having the vet then reiterate what you're saying and support rather than go against you and
yes, exactly.
Not go against, or give a different
touch wood. Dr. Nick has always agreed with what I have said.
There you go. It's a nice way of check. I knew what I was doing.
Yeah.
And in terms of the cases, how have you found? I remember, and like I say, it was many moons ago, but I remember when I first started, and everything seemed stressful, even down to like, what was the dose of this drug? And there was a lot of time spent worrying that I'd given the correct dosage, I'd got the correct diagnosis. Have you found after a year that that's become easier?
Definitely, it's become easier. So when you do your clinics at Onderstpoort, that is the biggest issue, is trying to remember all the drugs, because when you're in lectures, you just know the drug names, you don't know any of the dosages, you don't know the trade names. That was the biggest issue. And then you go into CCS and you start working with it a little bit, but you only have so many drugs to work with. Going into private practice, I'm still looking up dosages and things, but you do get used to it.
And it gets less exhausting.
Yeah. And in terms of, I still worry about, have I got the diagnosis right? And I think that is just part of being a vet. You don't always, a lot of the time when you can't do all the diagnostics that you ever want to do, you are guessing and you treating for your best guess, and you hope that it works.
You often get feedback as to whether it works or not. Eh?
Yeah. Most of the time you are right, but those other times you do have to do the x-rays, the ultrasound, the other tests that are needed.
Yeah. And you've got to get owners' buy-in for that, like you said before.
Yeah.
So there's obviously a lot of discussion at the moment within our profession about burnout, mental health. What is your what is your view on it in terms of, did you struggle any difficulties, particularly transitioning from very high pressure final year and doing exams to stressful CCS? Have you found that this has been a period where you've been tested the most, or how have you managed yourself in terms of not feeling like that?
I haven't felt burnout as yet, but admittedly I've only been in practice so long. But the draining part is all the euthanasias. I think that does take a toll on you, in which case you just have to talk it out with people. You can't hold it in. We had a bad episode in March last year. So I just started in the February, and then in March I was doing almost a euthanasia every day. And I was like, this is getting too much. And I think Nick saw my face and he took me aside and was like, this is not normal. Because this is how I thought private practice was going to be, as I'm just going to be, unfortunately, euthanizing animals. And that is not why I came into this industry. And luckily, it wasn't. It was a very unusual point in that part of the year. But at that point, that did take a toll, because I'm now a new vet, new in private practice, and I've got all of these emotions. So being a vet is not only mentally draining at the end of the day, but it's emotionally draining, and sometimes it's physically draining as well, because you're having to restrain animals and work with these big animals, and
the hours are long.
Yeah, the hours are. So you get exhausted. That is the one thing I found, is you just are tired, and I'm going to bed at like 8:30.
Gone are the student days.
Yeah.
Hey? And so how have you mitigated some of that? Have you put any sort of what you would see as healthy practices into place to say, look, I'm aware of this? Because there definitely is more discussion at Honest to Put, from my understanding, about how not to burn out, how not to be impacted by some of the negatives, which I'm super grateful for. What are some of the things that you've put into practice in terms of, other than reaching out to your mentor when things are getting tough?
Yeah.
Just in terms of your lifestyle.
Just having a work-life balance. So luckily our hours at Watercrest are good. So I have that time after work. We finish at 5. I have that time after work to do things that I enjoy, and that's mainly horse riding. And I live on the property with the horses, so I'm very lucky. And then just having that time to just chill. So finding a hobby that's just yours is important. And I was watching a webinar the other day on exactly this, the burnout, and he just recommended breathing. You know the importance of breathing during your day, complete silence to carry on. And you can get so wrapped up in your day when things get busy and you can't do this and that and blah, blah, blah. You just need to stand still, even if it's for like 10 seconds, breathe and continue. And I have found when you are less stressed, you actually get through your day better.
Yeah, and you're less likely, obviously, to make mistakes. Or you communicate better. I mean, all the knock-on benefits of not feeling that stress and anxiety in your role. So in terms of, are you finding now after a year, a lot of things, common things are common? So, you go, I don't know how I'm going to ever cope with a terrible ear complaint. And then you see one, you go, oh, that worked. Okay, reassured. The next one comes in, it works again. Are you finding that a lot of the cases are repetitive and you're now feeling more confident to?
Yeah, definitely. Yeah. That's the case. And in KZN, we're seeing a lot of itchy skins. That really wasn't seen at Onderstepot, because in Gauteng, we don't have the humidity and the pollens and everything that we have down here. So itchy skins, allergies, ear infections, those are very common. And then obviously your vomiting and your diarrheas. That's lots of things can cause vomiting and diarrhea, so you need to rule out all of those causes. But there are definitely things that patterns. You're like, okay, I can deal with that case. That one's going to need a little bit more thinking.
And have you found any points, I mean, it's early on, and I wouldn't expect you to have, but have you sort of been drawn to any particular area within small animal practice that you go, I'd like to pursue that a bit more? Is there something that's sort of that interest?
It's difficult because I have an interest in a lot of things.
That's good. That's good.
I have an interest in surgery at the moment and ophthalmology, but then medicine's also, there's a lot of things that I'm interested in. So I was thinking of, when I can, do a postgraduate diploma in a few of them and then figure it out from there.
That's great. I always think it's so important to maintain interest, and I think sometimes it can feel every day is different. That's what's wonderful about what we do, and something can come and totally surprise you, and you go, I did not anticipate that. So it does keep the interest there, but it is nice to be able to pursue things that you enjoy doing and to start then seeing more of those cases longer term.
Yes, yeah.
And then in terms of how do you find your colleagues are doing? Because from my impression, there are a lot of people who will start positions and then move to other practices and stuff. How have your friends and your colleagues coped with their first year?
They seem to have all coped very well. Everyone, except for the people that have been doing internships, everyone has stayed within their practice that I know of. Okay. For the first year. So there hasn't been a lot of chopping and changing, which is good to see. And surprisingly, our year has a lot more people wanting to pursue specialist degrees, which is quite nice well to know. A lot of people are doing internships and wanting to pursue further in different fields.
So let's talk about that. Let's talk about you've completed your CCS year, because that you have to do, whether you want to do residency or an internship or whatever it may be afterwards, the prerequisite of going out there in South Africa or continuing as a vet in South Africa, you've got to do your CCS. What then are the options? I mean, you can go into private practice. Do you have people who've gone into government work? What are the general options when you're sitting there going, okay, what next? And I'm interested because you're clearly a horse rider and love horses. Why small animal?
I would love to do horses.
Just can't fit them in that consult room, can you?
I just haven't had the opportunity yet to be able to do them, or the confidence right now to either, because there's only a few weeks at Ondersteport that you get of horses. I didn't see any horses in my CCS year.
Wow.
So the thought of doing horses at the moment is a bit scary. So I would need probably a good mentor if I were to go down that field. But I know the hours and everything, and especially as a female vet, it can be quite hard in the equine industry.
Let's list the various avenues you can go into if you want to go into like clinical work, but there are also opportunities where take us through.
So there's obviously your clinical work that you can do as a vet, and that's your typical thing that you think of as a vet when you go to the vet. But vets are also involved in your primary animal health care, such as your government positions that we are doing our CCS, or we're involved in public health. So that's your meat safety, your milk safety, all of that. You don't think of a vet being in charge of import and export control, but that's all things that we are involved in. Disease control within the country. So we had, obviously, rabies is specific for small animals, but in the production animals, there's a lot more to think about, such as brucella, foot and mouth disease, all of those diseases. And then a vet can also go into the corporate world as well if they find that none of those are suited for them. So there's a lot of opportunities for us.
Lots of opportunities. So you get to the end of it and you go, this is not for me. You've got choice and options. Why are we losing so many vets to abroad? Why? I ask with tears in my eyes.
I'm not entirely sure in terms of my perspective, but in terms of my friends' perspective, there's just more opportunity overseas. They are able to have a work-life balance that a lot of vet practices aren't able to have here. It's very common to have a 4-day work week, let's say in Australia or whatever. The pay is better overseas, and you have a lot more exposure in terms of practices being able to show you things and learn new things. I think that's what the appeal is all about.
Mm. And you find a lot of those vets do return back, but to be able to earn in another currency and then come home to South Africa,
yes,
having paid off student debts, and
I think that's very tempting as a young vet as well as to explore. I mean, you've been studying for 6 or 7 years, and you want to now see the world. Yes. So that's also definitely a factor.
Yes. So you made mention of insurance or people being in a financial position to afford us as vets and to afford their pets treatment and having great case workups. How do you manage that conversation? What is it that you've learned in this time when people are not in a position to afford it? How do you generally approach that without having it impact you emotionally and personally?
So I always tell them what I would like to do, so they know that those options are available. I don't want to assume anything, because these are difficult conversations. I always put the options out there. I tell them I know it's expensive, and then they feel then more comfortable to tell me, yes, that's out of my price range. And then I say, okay, we'll work our way around it, and try to find other options. But if they, for some reason, say yes and they can afford it, then great. But I want everyone to know what all the options are so they can make an educated decision for their animal.
That is a really great approach.
Yeah.
Why do you think there is mistrust or a lack of confidence with us as a profession? Why do you think there are, and I have to do a disclaimer there because there are so many clients and so many pet owners who really do value the work that we do, but where do you think the small minority, why are they losing trust in vets?
I think social media plays a big part in it. There's a lot of misinformation going around as what they should and shouldn't do for their animals, and people are saying this that don't have the knowledge to be making these claims. So then when your vet makes the opposite statement, then they don't know who to trust. But we as professionals will always do it based on a scientific approach. We base every decision on what the science tells us. So whenever a client, if they ever were to ask why, we can give them the studies to show them why. Whereas all of these other social media influencers, would they be able to give any of that information? I don't think so.
I agree.
And that's something that you need to think about when you're consulting with a vet. Also, I think just you have to find the vet that works for you. Trying to trust someone that doesn't seem to love your baby the way that you love someone is you're not ever going to have that connection. You need to find the vet that works for you and your fur baby, and then you go from there.
So build a bond with your vet.
Yeah.
And go on that journey with them.
Yeah. Yeah.
So true. And before we miss the opportunity, what has been your best thing about being a vet? What do you absolutely love about it?
The animals. The animals are the best part, and seeing them so sick and then coming back and they are so much better is definitely the best part, and why I came. And you have to keep reminding yourself when you have those bad days, this is why I'm doing this. It's for them.
Yeah, and when you've got the right motivation, it does just make it so rewarding.
Yeah.
Oh, I'm really grateful for you coming and sharing your experience. And thank you very much. I think, it's nice to have you down the road. And
thank you for having me.
Yeah, lovely to finally have met you and the work that you're doing.
Thank you.
That was great. Thank you. Thank you so much for tuning into today's episode on the Paws and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcasts. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Justin the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.